Women who are physically fit have a much lower risk of having a stroke. Researchers at Harvard University looked at 40,000 women aged 45 and over and at the levels of physical activity they did. The women reported how much physical activity they did in their leisure time, specifically how much time they spent walking and at what pace, jogging, running, biking, doing aerobic exercise or dance, using fitness machines, playing tennis, squash, swimming, doing yoga, stretching and doing toning exercises. 579 of those women went on to have a stroke, and when the researchers compared the level of physical activity between the women who had the stroke and those that didn't, they found that the more physical activity you do, the less likely you are to have a stroke. Women who walked 2 hours or more a week were at a 30% reduced risk of having a stroke. And those women that were most active during their leisure time had a 17% less risk of stroke than those women who were least active. Interestingly, it was moderate exercise that was associated with the largest benefit. Vigorous activity didn't seem to confer any greater benefit than moderate exercise. Moderate exercise should make you just puffed enough that you have trouble carrying on a conversation. A lack of physical activity isn't the only risk factor for stroke. There's smoking, high blood pressure and obesity. So there are lots of other things you need to do, but changing your physical activity level is easy and it will lower your risk of stroke. So if you're looking at increasing your physical activity level, speak to your doctor or practice nurse or head to our website for some great tips.